Okay, we have a couple changes to the agenda. Item number 3.1 would be pulled because there was a mistake in the information that we received. And under action items, 4.1 will be changed to a review on the health insurance and not action. So I believe the next meeting will receive information of both them. So with those changes, is there a motion to approve the agenda? Okay, we got a motion and a second. Any further discussion? Okay, seeing none, all those in favor of the agenda as amended signify by saying aye. 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 Opposed, same sign. Motion carries. Okay, we'll move on to item 4.1 and review of the 2018-2019 Health Partners Health Insurance Renewal. Lori.
Mr. Chairman, members of the board, Superintendent Funk, for your consideration is information regarding our renewal with NGPA Health Partners for the 18-19 year. This first slide just shows what our current premium is right now, and in the blue column is the renewal rates. The renewal reflects on overall average amongst the three plans, 7.21% increase of premium. Basically has to do with claims drive our premium. So that is what we're seeing here. On the next slide, this shows our history from the year that we left the South Central Service Co-op and went to NGPA. You can see some years that we've had a premium decrease. Some years it's been very low or a 0% increase, and some years it's been a double-digit increase. Overall, it's a 7.21% for the 18-19 renewal. Kind of interesting to see that in our 8-year average now, since we've been with NJPA, the average increase comes to 4.51%, which is actually quite good, a quite good average for that insurance renewal. The next piece of information I just want to share with you, and I've been including some of this information now and then. With success of the Wellwork Clinic, the good news is that it continues to be very much utilized by the staff that's covered under the district health insurance plan. In 2017, the number of reported visits was 1,956. And also another interesting statistic is that medications dispensed is 1,345. And that equates not only to convenient service, staff are utilizing it, it is run through claims on our insurance plan, but there is no copay, there's not a deductible, so there's no cost to the employee. And then on the last slide, what's an added plus with the Wellwork Clinic is that it is saving our health plan money because it is a cheaper service model. So if you compare a visit in the Wellwork Clinic compared to an average office visit, if our staff had gone to a different clinic in town or elsewhere, it is a cheaper clinic visit. And also where we really see a lot of savings is actually in the labs and in the prescription costs. So in the end, Health Partners did an analysis, and they found that in 2017, the cost avoidance by having such high participation at the Wellwork Clinic saved our plan $364,000. So that savings did help us with our renewal. Our renewal would have been higher percentage-wise if it hadn't been for the Wellwork Clinic. So just want to hit those highlights. This information will be shared with the units of the bargaining units. I had to move back. The meeting was scheduled for tomorrow due to a variety of things. Also, the need to get the updated report from the consultant I did move the committee meeting back a week, so it'll actually be April 10th is when I'm having the health insurance committee meeting. And this information and information from the consultant's analysis and some other wellness information will be shared with the health insurance committee. And basically, that is a highlight of the renewal information.
Any questions or comments?
Yeah, it doesn't have anything to do with renewal rates, but could you refresh my memory as to how our clinic compares to any other clinic in town in terms of services available? Is it a full service clinic? And you mentioned lab work that's available at this clinic. I mean, so it compares almost one-to-one to any other clinic, specifically the clinic in the Mayo Healthcare clinic in town.
So yes, our Wellwork Clinic is staffed with a nurse practitioner, and that is the one and only staff person at the Wellwork Clinic. And individuals can go to for a variety of medical conditions, but you know, from anything from a physical exam to if they're, let's say they have a sore throat, sinus infection, anything like that, they can go there to get treated. They can also, if the coordination with the regular physician exists with the Wellwork Clinic, so if the regular physician, say a patient needs to get routine lab work done to check whatever it might be, cholesterol or whatever, they can go to the Wellwork Clinic and get their lab results sent to their regular physician if it's at the Albert Lee Mayo Clinic. And so all that can be coordinated, and many of our employees are utilizing it in that way. Prescription drugs, our Wellwork Clinic offers a wide listing of prescription drugs, but they have to be generic. But that is very commonly used, and more staff are utilizing it in that way. Such things as they can get various vaccinations. In fact, we just sent out information on the new shingles vaccine, so you can get that type of thing. We do offer a flu shot clinic that's unique, that it's we go around to each site that's not part of the Wellwork Clinic, but we still had a lot of staff that utilized the Wellwork Clinic for their flu shot, and that's something that we'll be sharing with the insurance committee when we meet next week. Like for those staff that are on family insurance, their child can go to the Wellwork Clinic for the sports physical, for example. So those are examples of the types of medical services that are performed there at the Wellwork Clinic.
I've been working with a committee to save our hospital, and I think that one thing I've learned is that there are several businesses in town that have this type of clinic, and a lot of them have gone together, and so it is a way to save those dollars because it's a lot less expensive, of course, than going in the Mayo Clinic. So pretty common.
Lori, any idea on that 364,000? What kind of percentage did NJPA say that saved us 4.4% or anything like that?
This isn't an official statistic, but I did ask. I talked to Laura Dwyer from NJPA today that when they come down to the health to the district for the health insurance committee meeting, I want them to share exactly, but just roughly, I was told it's about a percent that it saved us on we would have been probably around an 8.25%, but reduced it down to 7.21%. So, but she will be providing us with more specific details when she comes down to the insurance committee meeting.
In this study by the consultant, did they kind of do a comparison with PEEP as well?
Yes, the consultant that we pulled the report for That comparison was comparing NJPA with PEEP. That is correct.
Okay, and do we have the results, or is that where the numbers kind of got to get figured out a little bit better first?
Yes, they had to revamp it because there was a piece that was missing that needed to be reclarified, and so, and it has a big impact on the outcome. So, yes, I will be receiving and reviewing that, and then moving and sharing it with the insurance committee and the teachers.
Okay, and then when we get the report like finalized, can we get that sent to us as well? Is that fine? Okay.
Yep.
And then we'll have an opportunity to talk about it at the next board meeting as well, before we approve anything with insurance for next year.
Okay, and then a couple of other more questions. If the district did go with PEEP, is it possible to have a Wellwork Clinic with PEEP, or is that only an option with a current insurance provider?
When we met with people about a year ago, that's one thing that they made clear is that the PEEP pool could not enable us to run it through claims like it is now. Their business model does not accommodate for that. So what they clarified is if the district desired to continue having the Wellwork Clinic, our general fund would have to bear the full burden of the cost of operating that, which is about $300,000.
And then another question, my district actually went to PEEP, so I'm a little rusty on it all though too. But I know like on certain years the teachers can vote on it and it would automatically go to PEEP if that was there, so vote, and then on other years it's different, the teachers would vote, but then the board would have to approve. What year are we on here? Do the teachers need to vote first before we plan to renew, or how does that work in this year? I think it's an every other year deal.
I'm not sure what year we're on. I think we're on the off year right now. Okay, and so basically how it works for our district is this, for most districts. The teachers can vote to go to PEEP, okay? So they could take the teacher unit, which is almost 300 people, and go and vote to go to PEEP. Then it'll be up for the school board to decide whether the board wants to take the rest of the district and go to PEEP as well, or to stay with the current plan that they have with Health Partners. So if at some point in the future the teachers choose to vote and go with PEEP, then it'll be up to the school board to determine whether or not the rest of the district goes. For example, Plainview, Elgin, Millville, a number of years ago their teachers went to PEEP. The rest of the district stayed on whatever the district plan was. So it's kind of a two-step process.
And then a final question on that then, if the teachers can and may choose to vote to go to PEEP, shouldn't we wait till that happens to do our renewal? The renewal's in June, am I correct on that?
Yeah,
that we have a little bit of time here?
That's why I think we're in the off year, okay? And I owe you that answer, but I think that the way the statute is written, it's every other year that they can go to it, and I think we're in the off year cycle. But right. Okay. Yep. But I owe you that answer.
So then the 300,000 roughly that we would have to pay the difference for would then, just to clarify, come from the general budget somewhere, which could mean cutting other things in order to keep a wellness clinic if it wasn't, I want to say funneled, wasn't able to be billed through the PEEP program. Is that right?
That is correct. Basically, that's the bottom line. Mm-hmm.
More question. I wrote it down, but I didn't get the whole number. What was our average increase over time? It was 4.5. Okay, thank you. Good memory, Dave. Thank you.
4.51%. Yeah. Sure. Mm-hmm.
Okay. Any other questions or comments? we can move on then to item 4.2, and that's a resolution appointing election judges for the May 8th special election. I think we were up to 9, if I counted correctly, on there, and we added 3. Is that correct?
That is correct. Mr. Chairman, members of the board, Superintendent Funk, for your consideration is the resolution for appointing election judges. And yes, they are identified by polling location, lines with new polling locations that were previously approved. And just as an FYI, the minimum number of election judges at a polling location is 4. And many of the locations have even up to 8, so that the head judge can set a schedule, a rotating schedule for judges to cover certain portions of the day. And then we also have substitute judges approved, so that in the case that someone's out sick or something, we would be able to pull from the substitute list. And then also, we have a listing of the absentee ballot board election judges, and that's basically the staff at the county auditor's office that are handling our absentee ballot process. So that's just a summary of the data in the resolution.
I believe that absentee ballots have been available for quite some time. I know also that conversations with the county is they're going to go right to the nursing homes, so people have the opportunity to vote. So I just wanted to mention that's in place. So is there
Oh, I just had a question about that. So is that standard procedure to go right to the nursing home with absentee ballots?
I guess I can't answer that.
Or was that requested?
We didn't request it.
But we don't know that it's standard operation.
I can maybe address that. It is a standard process. The nursing homes, whereas the residential nursing homes, so it's not assisted living or apartments. But yes, it is standard process to have the designated judges. It's coordinated with the county auditor's office to go to those residential nursing homes on a particular day. We line it up ahead of time.
Thank you.
Okay, this is an action item. Is there a motion to approve?
So moved.
Okay, is there a second to the motion?
Second.
Okay, the motion's been made and seconded. Any further discussion?
I had a question. So do we know how much the election judges are expected to cost the district?
You'll see attached is a memo of the rates of pay that are proposed. And so the judges we've paid to attend, obviously, whatever, they'll keep a timesheet for whatever they work for the election. And so, for example, when the head judges come and do the public accuracy test, they'll get paid for that, et cetera. And so, yeah, they keep a timesheet of any work they do regarding the election.
Thank you. And does this charge then, is it in addition to the $25 million referendum itself? It comes out of operating funds, or where does this come from?
Like with any election, whether it's a board election or operating referendum election or a bond referendum election, it's a general fund expense. So any of the election judges' costs for the ballot, et cetera, those are all a general fund expense.
Thank you.
Okay, any further discussion? Okay, we'll call the question then. All those in favor of the resolution appointing judges for the May 8th school district special election signify by saying aye. Aye. Oh, it's a roll call. Okay. We'll start with Angie then. Aye. Aye. Okay, motion carries. Okay, we covered our agenda items. Is there a motion to adjourn?
So moved.
Okay. Meeting is adjourned.